Well, cancer patients at the Kolebu Teaching Hospital are facing extended delays and suspended appointments as the hospital's only radiotherapy machine is unable to cope with the rising demand. The machine, which has experienced frequent breakdowns, was recently repaired but continues to operate at a reduced capacity, limiting the number of daily treatment sessions. Rejoice Semefa Kwesu has been to the hospital's oncology department and now reports.
8-year-old Joshua is having one of his 33 sessions for the treatment of cancer.
Pain. I feel pain. What
do you want to become? You told me you love John Mahama. You can give a shout out to John Mahama. Anything you want to say to him?
President John Mahama, please, can you help me with my treatment, please?
You are hoping to get back to school soon. Okay. You're hoping to get back to school?
Yes, of course.
That's all I know.
Yes, of course.
He's one of the lucky few, as many have been told to hold on with their treatment. Appointments for patients requiring more than 6 treatment sessions remain suspended as oncologists at the hospital await comprehensive maintenance on the radiotherapy machine, which is currently operational but limited to just 10 sessions per day.
The engineers posted here by the company, the local agents, did work. They worked on the machine. They worked on the machine, and somehow they were able to get it back online. But they realized that when it stays on for a few hours, then the problem resurfaces. So then management has taken a decision that we are treating, as a stopgap measure, we are treating patients who have about 5 to 10 treatments left, right?
Professor Joel Yane is head of oncology department at the hospital.
We should pay attention to non-communicable disease and cancer in particular. Yes, because our disease profile is changing. It's not only Ghana, most developing countries, the disease profile is changing. They're having more non-communicable disease, more cancers. And radiotherapy plays a very important role in the management of cancer.
On the 4th of July 2024, patients arriving for the scheduled treatment were turned away as oncologists at the Kolebu Teaching Hospital scrambled to bring engineers to repair the only radiotherapy machine, which had broken down due to excessive use. Some patients were worried.
I was scheduled for radiation treatment, which will take 16 working days. But I realized that they were having issues with their machine. I was scheduled last week, Thursday. I did a Thursday and Friday, and I'm supposed to continue from Monday up to date. After those 2 treatments that I had, I've never had any.
This incident occurred just days after oncologists at the Komfonochi Teaching Hospital withdrew their services in protest over delays in repairing the cancer treatment machine at their facility.
It is unfortunate that our colleagues, a section of our colleagues in oncology, have taken this action.
Professor Yane, having experienced the pain patients are going through, wants government to bring in more machines.
Government is aware, and there's a master plan. Yeah, there's a master plan. The plan is to have associate, because it's very complex and cancer management is quite complex, we associate it with the teaching hospitals. So the plan we have now is to have one in Tamale, one in Cape Coast, and one in Ho, because they have medical schools, and therefore we'll have the human resource. People who do some cancer work, right? So these will be new centers. Then Komfonochi and Kolebu will have additional machines. So they will have 2 each. So that when such a problem arises, we can solve it. Unfortunately, we have not been able to implement our plan. Mind you, I told you that the machine costs getting to about $2 million.
Rejoice Semifak Pursues report for Joy News.